Great. So as Angie mentioned, I'm going to be discussing lead and water in childcare facilities today, focusing primarily on a pilot project EDF conducted over the past year. But before I dive into that, I'm going to talk a little bit about just some background on lead and water. So I apologize if this is old hat to some of you, but I just want to make sure that everyone's on the same page. So how does lead get into drinking water? Source water rarely contains lead, but lead can get into water from older plumbing. And there's two broad considerations that affect the likelihood of lead getting into the drinking water. The first is the service line, and the second is premise plumbing. So as you can see in this image, the premise plumbing may include sources like lead solder connecting internal copper piping and brass fixtures that contain lead. So actually almost all water meters, faucets, valves, and fittings manufactured prior to 2014 have brass components containing lead. And then lead service lines are lead pipes that connect the water main under the street to the residence or other type of building. So let's look at that a little bit more in the next slide here. So as you can see in this image, the service line is a pipe that connects the water main under the street to the building, which is the blue line in this image. And when the pipe is made of lead, we call that a lead service line. And the biggest problem with lead service lines is they can unpredictably release particulate lead, especially when the pipe is disturbed through construction or other types of disturbances. And when they're present, lead service lines contribute an estimated 50 to 75% of lead in drinking water, so they're the biggest source. And while most water utilities treat their water through a process called corrosion control to limit the leaching of lead, this corrosion control can unpredictably fail, and lead service lines can still release particulate lead. So the best long-term solution, we believe at EDF, as well as a number of other national organizations, have supported the solution of removing them as the long-term approach. So just a little bit of history here. Lead was frequently used in plumbing because it's malleable and easy to work with. So it's a very effective tool from that perspective. But as we know, unfortunately, it also has health impacts. And so in 1986, Congress amended the Safe Drinking Water Act to prohibit the use of pipes, solder, or flux that are not deemed lead-free. And at the time, they defined lead-free as no more than 0.2% lead in solder and flux and no more than 8% lead in pipes, plumbing, and fixtures. And that effectively banned lead pipes. And then in 2011, Congress further limited lead in brass fixtures and fittings from 8% down to 0.25%, which went into effect in just 2014. So where exactly does that leave us today? How big is the problem? There are an estimated 6 million homes in the U.S. with lead service lines and millions of older buildings with lead solder and fixtures across the country. And of course, this is also relevant to the context of childcare facilities. And as lead has no taste or color, in general, we have to test the water to know if it's there. But in the case of lead service lines, there are other mechanisms such as visual inspections and review of historical records and utility records that can be used to identify them. All right, so to the point of the call, childcare. So neither schools nor childcare facilities are required to test for lead in water in the U.S. under the lead and copper rule unless they qualify as a public water system. And that leaves about 100,000 public schools and 500,000 childcare facilities unregulated by federal law. And while we believe addressing the issue in both schools and childcare is important, we see childcare as a critical gap for a number of reasons listed here on this slide. So first, children under the age of 6 are more susceptible to the detrimental impacts of lead. Two, it can be harder than in schools because there isn't the same level of facility support. Because they're usually private, there may be less public accountability than with schools. And then, of course, there's the added layer of complication that many childcare facilities go unlicensed. And then finally, another challenge compared to schools is that while schools are unlikely to have lead service lines, childcare facilities may in fact have them. And that's because lead is heavy, no surprise there, right? And so lead pipes were not made with greater than 2 inches in diameter. So larger facilities as most schools are unlikely to have lead service lines. But smaller childcare facilities, such as those in homes, may have them. And then also, I just wanted to point out that there are 9 states requiring lead and water testing in childcare. This number has been going up over the past few years. When we started this work, I think there was only 5 or 6 states that required it, so that the landscape is changing quite rapidly here. So in 2006, EPA published a voluntary guidance for lead and water testing. And EPA actually updated this guidance just last fall, but I want to take a moment here to discuss the earlier 2006 version because that's what we were working with when we conducted our pilot project. So the earlier version was based for schools and then adapted for childcare. And we found that it had significant gaps in the context of childcare. First, it had an action level of 20 parts per billion. So that means the level at which you trigger remediation if you find lead levels above 20 parts per billion in the water. That would trigger some sort of action. And that number is not based on health. And then the guidance also had little to no emphasis on lead service lines, despite the fact that child cares are often based in homes which can have them. So at the end of the presentation, I'm going to come back to the updated version of the guidance. I just wanted to give you that background at the front. All right, so transitioning now to talk a little bit about our pilot project. So we worked with local partners in 4 states. Those are in green: Illinois, Michigan, Ohio, and Mississippi. And what this map does is it overlays those states with those that have regulatory testing requirements, and those are with the blue hatches. And then it highlights our partnering organizations. So in Grand Rapids, Michigan, we partnered with the Healthy Homes Coalition of West Michigan to test at 2 facilities. In Cincinnati, we partnered with both the local water utility as well as a home repairs nonprofit called People Working Cooperatively. In Mississippi, we tested in Starkville as well as Tunica and partnered with the local university there, Mississippi State University. And then finally in Chicago, we tested at 4 buildings working with a local nonprofit called Elevate Energy. And you can see that Illinois is the only location we tested with that actually had a state requirement. But when we started our testing, the law was in place, but the regulations weren't. So the specifics of the testing requirements had not yet been established. So what did we do? Again, we worked with local partners to implement testing and remediation in 11 child care facilities serving children from low-income families under the age of 6. We collected over 1,500 samples at nearly 300 water fixtures, including samples taken before and after remediation. And that remediation included replacing 26 fixtures, removing 2 lead service lines based on visual inspection and record review, draining and flushing 10 water heaters to remove settled particulate, which I'll get into more later on, and then routine practices including flushing and cleaning aerators. So we used EPA's 2006 3Ts guidance that I mentioned 2 slides ago as a This pie chart represents the first draw baseline samples, or in other words, the first water collected before any remediation took place. And the good news here is that we found that over 75% were below detectable levels of lead. and 6% exceeded our action level of 3.8 parts per billion, and just 1% exceeded 20 parts per billion, which again was the action level in EPA's 3Ts guidance. But the graph on the right is a slightly different way of looking at this information. So what this shows is that the highest lead levels detected in drinking water sources at each facility. So the bottom row, you can see at 4 facilities had no drinking water sources with levels above our action level of 3.8 parts per billion. So they were, in the clear in our eyes. And then 4 had at least one drinking water source between 3.8 and 20 parts per billion. And then 1 facility had at least one drinking water outlet with levels between 20 parts per billion and 80 parts per billion. And then 2 facilities, one of which was in Chicago and one in Cincinnati, had at least one sample above 80 parts per billion. And actually, one of the Chicago location actually had 11 fixture replacements because we had quite a few that exceeded our action level. So for reference, 80 parts per billion is 16 times the amount of lead that is allowed in bottled water by FDA, which is 5 parts per billion. So just stepping back here, what's the takeaway? On the one hand, the good news is most samples had non-detectable lead levels, but the bad news is that we did identify a number of problematic fixtures at locations like kitchen sinks that could be used regularly for drinking water. So what did we find in terms of interventions? First, I'm going to talk a little bit about flushing. And just for background, if you're not familiar with that term, that basically just means allowing the water to run for a specified period of time before collecting the sample. And that can allow contaminated water to flush out of the system. So as I noted earlier, we conducted both 5-second and 30-second flushes. And the good news here is that we found that quite short flushes were effective in reducing lead. So on average, a 30-second flush reduced lead levels by 3.9 parts per billion. And a 5-second flush came close to that. It wasn't quite as good, but it did reduce levels on average by 3 parts per billion. So we think that as a very practical recommendation, a 5-second flush is an effective strategy, a relatively effective strategy without any cost. And then we also evaluated the impact of aerator cleaning. So the aerator is a removable screen at the end of many faucets. It's pictured on the bottom right here on the slide. And it's typically recommended as a routine maintenance practice to remove any lead particulate accumulated in the screen over time. But unfortunately, we actually found some surprising results here. We found that the aerator cleaning actually increased lead levels on average by 4.5 parts per billion. And this was largely driven by results at 2 centers where we saw levels jump dramatically after cleaning the aerator. So in one instance, we saw a non-detect one day, and then we cleaned the aerator, we tested again the next day, and it actually jumped up to 91 parts per billion. So we aren't 100% sure why we saw this. We have a few theories. One is if the aerator is insufficiently cleaned, the process of removing the aerator and cleaning it to some extent might just loosen up the lead particulates without actually washing them away. And then another sort of explanation might be that the process of removing the aerator may actually disrupt the protective scale built up through corrosion control. So it's the water treatment that I was talking about earlier. So this is really an area where more research is needed, but in the meantime, we're recommending soaking aerators in vinegar to allow any trapped lead to dissolve and more easily be washed away. So as I mentioned earlier, we conducted 26 fixture replacements based on our health-based action level, and the lead reductions or the changes between before and after fixture replacement are illustrated on this slide. And we found for the most part that fixture replacement was very effective in reducing lead levels, as you can see here. Unfortunately, we found that we couldn't consistently reduce the levels to below our action level of 3.8. So on this graph, you can see that I've zoomed in on the lower half of the previous graph. And when initial lead levels were low, so less than 5 parts per billion, on average, replacement actually led to 2 parts per billion increase in lead. You can see it for a few of the fixtures, you can see a jump there where the lead levels went up after fixture replacement. And I haven't shown the data here, but over time, those did go down. We did want to monitor those to ensure that we were providing safe water. But, you know, that leaves sort of the question of why did we see this? And again, we have a few hypotheses, although we don't know with 100% certainty why we saw it. But our hypothesis is that the lead is coming from new fixtures. So again, the conclusion here, fixture placement was generally effective, but we couldn't consistently reduce lead levels to the lower action level. And we hypothesize that it's due to an inadequate NSF international standard that allows new brass fixtures to leach lead. So I'm just going to dive into that a little bit on this next slide. So under federal law, I mentioned this earlier, lead is still allowed to be intentionally added to brass and bronze up to 0.25%. And the NSF ANSI 61 lead leaching protocol for new faucets allows for considerable lead to leach and still pass the certification test. So under this protocol, a faucet can pass and still contribute more than 20 parts per billion in a 250 ml sample after repeated flushing. So in short, we may have replaced contaminated fixtures with lead, quote, lead-free fixtures, but those that we installed still may have had some lead in them, although we did see that level go down over time. All right, so I'm going to shift gears here and discuss some of the novel methods that we employed in our project. So first, unlike the 2006 EPA guidance, our strategy for lead service lines was to identify if they were present and replace them before doing any water sampling at the fixtures. And we took this approach because it can be difficult to identify a lead service line through water sampling, as they can unpredictably release lead particulates, and also because we believed that attempting to address lead at the fixture is unlikely to be of much value when there's still a lead service line in place. So our first step as part of this project was to review city, water utility, and childcare records to identify any information relevant to the presence of a lead service line. We then followed up by conducting a visual inspection, and through this process, we did identify 2 lead service lines and replaced them. You can see on the picture to the right here a lead service line that we found and replaced at a Chicago facility. So then our health-based action level, I keep alluding to this, and so I want to take a moment to delve into this a bit further. So we all know that the goal should be zero lead, but unfortunately, there is lead in our systems, and we need to know when it sort of reaches a threshold of when we need to take action. And so this is still a question up for debate, but for our project, we used 3.8 parts per billion in most locations, and then 2 parts per billion in Chicago, because we knew that regulations were forthcoming and likely to have a lower action level. But we derived this 3.8 parts per billion number based on a 2017 draft analysis that EPA conducted, providing a variety of modeled options. And while EPA hasn't yet finalized that, we took that information to propose our own health-based benchmark. So we essentially just chose certain assumptions that we believe to be conservative, which were based on an estimate of lead and water concentrations resulting in 1% increase in the probability of a formula-fed infant having blood lead levels of 3.5 micrograms per deciliter. And if it's of interest, I can dive into why exactly we chose those numbers. And then also for an infant living in pre-1950s housing. So just to step back out there, what did we find? Again, we found that the 3.8 parts per billion action level was not always possible to achieve. And until the NSF international standard is strengthened, we recommend an interim action level of 5 parts per billion. So through our pilot, we also evaluated 2 types of portable meters. And one of those is pictured to the right here. It's called the Palin test. And our vision was that if we could identify a reliable screening tool It would allow us to immediately do replacements, immediately remediate the lead, which could reduce delays in replacement, which is obviously health protective, and then also reduce the overall cost without having to send the samples out to a lab. Unfortunately, what we found was the field tool really underestimated the lead compared to the lab results. And so we didn't really feel comfortable relying on the meter as, to identify whether or not we needed to conduct any sort of remediation at a specific outlet. On the flip side, though, it was generally effective in screening for locations that were higher than 20 parts per billion. So for example, if the lab analysis came out at 100 parts per billion, the field tool might read around 10 parts per billion. So it would flag it, just not give sort of the accurate reading. So we're currently partnering with Greater Cincinnati Waterworks, again, the Cincinnati water utility that we worked with for our pilot project, and we're conducting a study to delve into this issue more. So finally, we decided to test water heaters because we had received some questions about whether water heaters might actually act as like a sink for upstream sources of lead if they are not routinely flushed. We thought it was kind of an interesting, novel question, and so we decided to explore it. So we took 2 samples from the water heater at the bottom drain, as well as hot water samples at the tap. And luckily, we found that the levels at the hot water taps were not significantly different than the cold water. But on the flip side, we found that 14 water heaters tested, all of which had some detectable lead levels. And some of the levels were extremely high. You can see on the graph here, before flushing, one was as high as 2,680 parts per billion. But the good news is that we found that pretty consistently when we flushed the water heater, and that basically just means draining all the water out and allowing it new water to flush through it for about 10 minutes, the lead levels went significantly down. You can see that on the graph. So based on this finding, we've been making the recommendation to routinely flush water heaters according to the manufacturer's guidance as part of a good maintenance practice. And then I just think this is an interesting picture, so I included the picture on the top right. The one on the left is the first draw sample from a water heater. And that's, you know, lead doesn't have any color, so that's not lead. It's just sort of a good reminder that the sediment can sort of build up over time in the hot water heater, and it's probably prudent not to drink hot water for a number of reasons beyond just the possibility of lead contamination. All right, so just to summarize here, our full report makes recommendations to a variety of different audiences, specific audiences like state regulatory agencies, child care facilities, and public health departments. But here I've highlighted just our top level policy recommendations. And the first of which is to prioritize the replacement of lead service lines, which are the largest source of lead in water when they're present. Second is to mandate testing for lead in water in child care facilities for those interior sources of lead. So again, like the fixtures and faucets. And then setting a lower action level to trigger remediation. So we suggested 5 parts per billion as an interim action level until the NSF international standard is strengthened. And then of course, we are recommending the NSF international leachability standard is reduced, and they actually are convening a working group currently that is evaluating different options for strengthening that standard for new fixtures and plumbing parts specifically for schools and childcare. And then finally, I'm going to come back to EPA's 3Ts guidance. So when we published this report back in June 2018, we made the following recommendations for EPA to consider in revising its 3Ts guidance. So first, to lower its 20 parts per billion action level. Second, to place greater emphasis on identifying and replacing lead service lines. Third, to develop a robust protocol for aerator cleaning because of those concerning results that we found. And then fourth, to address hot water and water heaters as a potential source of lead. And in October of this past year, they did update their guidance. And the guidance is now a web-based toolkit that is much more interactive and user-friendly than it was than the 2006 version was. It's written in a much less technical fashion, so we're hoping that means that schools and childcare providers will be more likely to use it. It also has downloadable templates and fact sheets like the one pictured on the right of this slide. So in a lot of ways, we think it's a huge improvement from what was out there in the previous version. But then specifically on sort of our recommendations, how did they stack up? First, they sort of hit the mark on the first one. Instead of lowering the 20 parts per billion action level, they actually removed it altogether. And now the language indicates that they recommend action where lead levels are elevated. But EPA doesn't define this term or attach any number to it. And it's understandably difficult to select a single level to trigger action, given that we know that there's no safe level of lead exposure. However, we're concerned that this approach may cause confusion and frustration for schools and childcare that are going to have to wrestle with this question on their own without any guidance. And we're already sort of seeing that play out at the state level. In terms of lead service lines, they did improve their content. The picture on the right here is an example from one of their fact sheets. So they're now recommending review of historical records and conducting visual inspections to identify if there's a lead service line, and they recommend contacting your water utility immediately if one is discovered. So that is definitely an improvement. And then the last two of our recommendations on aerator cleaning and hot water, heaters and hot water, really weren't addressed at all in the updated 3Ts guidance, but I think that's sort of understandable given that they are areas where additional research is needed and need to develop do additional research before evidence-based guidance can be identified there. So that's pretty much it. This is a picture of the full report, and the link here, it's edf.org/lead childcare if you want to learn more. Sort of just scratch the surface, and I know I went through a lot of content quickly, so if you want to dig into it more, please do check out the report. And the last slide here is just some other resources that might be of interest. So our child care report, again, is listed at the top. We also have a website that tracks state requirements for lead and water testing in child care facilities. So I didn't go into that in too much depth, but I can certainly answer any questions to that piece if folks are interested. And then a number of other EDF resources and blogs. And then at the bottom there's a link to the Lead Service Line Replacement Collaborative, which is a national collaborative of 26 national organizations organized around the effort to replace lead service lines through voluntary mechanisms. And then finally, a direct link to EPA's updated 3Ts guidance.